Part B. In this part of the test, you'll hear different extracts. You'll have time to read each question before you listen.
Now look at question 26. You hear a doctor called Mihiraa talking to a patient. Now read the question. Mr. Paul, I'd like to discuss the importance of measuring your serum amylase levels. This blood test helps assess the function of your pancreas.
I'm not sure what amylase is. Can you explain, Dr. Mihiraa?
Amylase is an enzyme produced by the pancreas. It plays a crucial role in digesting carbohydrates. Elevated amylase levels can indicate pancreatic inflammation, which can be a serious condition.
I see. Why is it important to monitor my amylase levels?
Regular monitoring of amylase levels can help detect early signs of pancreatic problems. This allows for prompt diagnosis and treatment, which can improve outcomes.
Dr. Mihiraa, are there any specific symptoms I should watch out for?
Abdominal pain, especially in the upper abdomen, can be a symptom of elevated amylase levels. You may also experience nausea, vomiting, or fever. If you notice any of these symptoms, it's important to seek medical attention.
Now look at question 62. You hear a doctor called Mihiraa talking to a parent. Now read the question.
Mr. and Mrs. Paul, I'd like to discuss the importance of brain imaging for your child Annie. Given her symptoms, it's essential to rule out any underlying neurological conditions.
We understand, Dr. Mihiraa. What type of brain imaging would you recommend?
A CT scan or MRI would be appropriate. These imaging tests can help visualize the structure and function of the brain.
Are there any risks associated with these procedures?
Both CT and MRI scans are generally safe. However, MRI scans involve a strong magnetic field, so it's important to inform us if your child has any metal implants or devices.
Annie doesn't have any metal implants. Can you explain the difference between CT and MRI scans?
CT scans use X-rays to create images, while MRI scans use magnetic fields and radio waves. MRI scans provide more detailed images of soft tissues, which can be helpful in diagnosing certain conditions.
We'll follow your recommendations, Dr. Mihiraa. We want to ensure Annie receives the best possible care.
Now look at question 63. You hear an occupational therapist called Mihiraa talking to a physiotherapist. Now read the question.
Evan, I'm concerned about Mr. Paul's progress in physiotherapy. He seems to be struggling with the exercises, and his mobility hasn't improved significantly.
That's interesting. Have you tried adjusting the exercises or using different techniques, Mihiraa?
Yes, we've tried various approaches, but he's still having difficulty. I'm wondering if there might be an underlying issue affecting his recovery.
Perhaps we should consult with a neurologist to rule out any neurological factors. Sometimes, underlying conditions can hinder rehabilitation progress.
That's a good idea. I'll schedule a referral. In the meantime, we could try incorporating occupational therapy techniques to address any functional limitations.
That's a great suggestion. Occupational therapy can help with activities of daily living and improve overall independence.
We should also consider the patient's motivation and emotional state. Sometimes, psychological factors can impact rehabilitation outcomes.
Absolutely, Mihiraa. We can involve a social worker to provide emotional support and address any underlying issues.
Now look at question 64. You hear a doctor called Mihiraa talking to a nurse. Now read the question.
Nurse Paul, I'm concerned about Mr. George's recent symptoms. He's been experiencing persistent fatigue, weight loss, and night sweats.
Yes, Dr. Mihiraa, I've noticed those changes as well. He also seems to be having difficulty concentrating.
Given his symptoms, I suspect an underlying medical condition, possibly a thyroid disorder or anemia. We'll need to conduct some blood tests to investigate further.
That makes sense. I'll schedule the blood tests and inform Mr. George about the need for additional testing.
It's important to address these symptoms promptly, as they could indicate a more serious underlying issue. We'll monitor his condition closely and adjust treatment as needed.
Dr. Mihiraa, will you be able to see him for a follow-up appointment soon?
I'll schedule a follow-up visit within the next week. We'll discuss the test results and determine the appropriate course of action.
Now look at question 65. You hear a GP called Mihiraa talking to a care home manager. Now read the question.
Mrs. Paul, I'm concerned about Mr. George's recent decline in health. He's been experiencing increased fatigue, confusion, and loss of appetite.
Yes, Dr. Mihiraa, we've noticed those changes as well. He seems to be losing weight, and he's not as active as he used to be.
It's important to investigate these symptoms further. I'd like to arrange a comprehensive assessment, including blood tests and a physical examination.
That sounds like a good plan. We're worried about him, and we want to do whatever we can to help.
I understand. I'll schedule an appointment for Mr. George to see a specialist who can evaluate his condition in more detail.
Is there anything we can do at the care home to support him during this time?
It's important to monitor his vital signs closely and ensure he's eating and drinking adequately. If he's experiencing any pain or discomfort, please let us know.
Now look at question 66. You hear a dentist called Mihiraa talking to a parent. Now read the question.
Mr. and Mrs. Paul, I'm pleased to discuss your son, Ryan's, upcoming dental procedure. We've determined that a dental cap, also known as a crown, is necessary to protect his decayed tooth.
We understand, Mihiraa. What exactly is a dental cap?
A dental cap is a custom-made covering that fits over a damaged or weakened tooth. It helps restore the tooth's function and appearance.
Will the procedure be painful for Ryan?
We'll ensure his comfort throughout the procedure. We'll use local anesthesia to numb the area around the tooth. There might be some discomfort after the procedure, but it should subside within a few days.
How long will the procedure take?
The procedure typically takes about an hour, depending on the complexity of the case.
Mihiraa, will Ryan need to avoid certain foods or activities after the procedure?
Yes, it's important to follow post-procedure care instructions. He'll need to avoid hard, chewy, or sticky foods for a few days. He should also refrain from strenuous activities that could dislodge the cap. Now look at question 67. You hear a physiotherapist called Mihiraa talking to a patient. Now read the question. Mr. Paul, given your persistent back pain, I think it would be beneficial to schedule an MRI scan to assess the underlying cause.
An MRI. Mihiraa, I've heard they can be uncomfortable.
It's understandable to feel anxious about the procedure. However, MRI scans are generally safe and painless. The only discomfort you might experience is from lying still for an extended period.
Are there any specific preparations I need to make for the MRI?
Yes, there are a few things to keep in mind. You'll need to remove any metal objects, such as jewelry or piercings. You may also need to change into a hospital gown.
Well, Mihiraa, I have a pacemaker. Will that be a problem?
Yes, the strong magnetic field in an MRI can interfere with certain medical devices, including pacemakers. We'll need to consult with your cardiologist to determine if an MRI is safe for you. Now look at question 68. You hear a nurse in charge called Mihiraa talking to Kaloj. Now read the question. Team, I'm excited to announce that we'll be implementing a 4-shift pattern in the ward starting next month. This new schedule aims to improve staff morale, reduce burnout, and enhance patient care.
I'm curious to know how this new pattern will work. Mihiraa, will it involve longer shifts or fewer days off?
The 4-shift pattern will involve working fewer days per week but with slightly longer shifts. This will provide staff with more time for rest and personal commitments.
I'm concerned about the impact on patient care. Won't longer shifts lead to fatigue and reduced alertness?
We've carefully considered this. We'll implement strategies to manage fatigue, such as scheduled breaks and opportunities for rest during shifts. Additionally, we'll ensure adequate staffing to prevent excessive workloads.
Mihiraa, will this new pattern affect our existing shift preferences or seniority?
We'll prioritize the needs of our staff and accommodate their preferences as much as possible. However, there may be some adjustments required to ensure a balanced distribution of shifts.
Now look at question 69. You hear an occupational therapist called Mihiraa talking to a nurse. Now read the question.
Nurse Paul, I'm concerned about Mr. George's comfort while in bed. We need to ensure he has the most appropriate type of bed to support his needs.
That's a good point, Mihiraa. I believe he's currently using a standard hospital bed. Is there a more suitable option?
Depending on his specific needs, a specialized bed might be beneficial. For example, if he has difficulty getting in and out of bed, a low-profile bed or a bed with adjustable height might be helpful.
He does have limited mobility. A low-profile bed might be a good option. What about pressure ulcers? Should we consider a pressure-relieving mattress?
Absolutely. Pressure ulcers are a significant concern, especially for immobile patients. A pressure-relieving mattress can help prevent skin breakdown and promote healing.
Are there any other types of beds we should consider, Mihiraa?
If Mr. George has specific needs, such as increased support for his back or hips, we might explore specialty beds with built-in features. It's important to assess his individual needs and select the bed that best meets his requirements. Now look at question 70. You hear a doctor called Mihiraa talking to a nurse. Now read the question. Nurse Paul, have you reviewed Mr. George's recent chest X-ray?
Yes, Dr. Mihiraa. There seems to be some abnormal shadowing in the right lung.
That's concerning. Could you describe the location and appearance of the shadowing?
It's a well-defined, round opacity in the upper lobe of the right lung.
A round opacity could indicate several possibilities, including pneumonia, a tumor, or a pulmonary embolism. We'll need to conduct further tests to determine the exact cause.
Should we order a CT scan or a lung ultrasound?
A CT scan would provide more detailed images and help us differentiate between the possible causes. We can also consider a lung ultrasound to assess for pleural effusion or other abnormalities.
I'll schedule the necessary tests, Dr. Mihiraa, and inform Mr. George about the need for further evaluation.
It's important to monitor his symptoms closely and be prepared to adjust treatment as needed. Now look at question 71. You hear a doctor called Mihiraa talking to colleagues. Now read the question. Team, I'm excited to introduce our new AI-powered chatbot, MediAssist. This innovative tool will streamline communication between departments and improve efficiency within our hospital.
That sounds interesting, Dr. Mihiraa. How will MediAssist work?
MediAssist will be accessible through a dedicated platform. You can use it to send and receive messages, request information, and even schedule appointments. It's designed to provide quick and accurate responses to your queries.
Will MediAssist replace human interaction?
No, MediAssist is intended to supplement human interaction, not replace it. For complex or sensitive matters, direct communication with colleagues remains essential. However, MediAssist can handle routine tasks and provide immediate assistance.
Are there any privacy concerns associated with using a chatbot, Dr. Mihiraa?
We have implemented robust security measures to protect patient data. MediAssist will only have access to information that is necessary for its functions. Your privacy remains our top priority. Now look at question 72. You hear a pharmacist called Mihiraa talking to a doctor. Now read the question. Dr. Peter, I'm concerned about Mr. Bob's medication regimen. He's taking multiple medications for his heart condition and diabetes, and there's a potential for drug interactions.
Thank you for bringing this to my attention, Mihiraa. Let's review his medication list and identify any potential conflicts.
I've analyzed his medications and found that his blood thinner and one of his diabetes medications might interact, increasing the risk of bleeding.
That's a good point. We'll need to adjust one of the medications or find an alternative.
I've also noticed that Mr. Bob's current dosage of his heart medication might be too high. He's been experiencing side effects, such as dizziness and fatigue.
We should consider reducing the dosage or switching to a different medication, Mihiraa.
I'll research alternative options and discuss them with Mr. Bob during his next appointment. Now look at question 73. You hear a GP called Mihiraa talking to an orthopedic surgeon. Now read the question. Dr. Peter, I'm referring Mr. Bob to you for a consultation regarding his persistent knee pain. He's been experiencing discomfort and swelling for several months.
Thank you, Dr. Mihiraa. I'll schedule an appointment for Mr. Bob as soon as possible. Could you provide me with more details about his medical history?
Certainly. Mr. Bob has a history of osteoarthritis and has undergone previous knee surgery. He's currently taking medications for pain management and inflammation.
Is there any recent trauma or injury to the knee?
No, he hasn't reported any recent accidents or falls.
It's possible that the knee pain is related to his osteoarthritis or a new injury. Mihiraa will need to conduct a thorough examination and consider imaging studies to determine the underlying cause.
I'll provide Mr. Bob with a referral letter and any relevant medical records. Please let me know if you need any additional information. Now look at question 74. You hear a radiologist called Mihiraa talking to a doctor. Now read the question. Colleagues, I'm excited to announce that we'll soon be implementing a new software update for our radiology imaging system. This update incorporates advanced features designed to enhance image quality, improve workflow efficiency, and ensure patient safety.
That sounds promising. What specific improvements can we expect from this update, Dr. Mihiraa?
The new software will utilize artificial intelligence to automatically detect and highlight abnormalities in images. This will help radiologists identify potential issues more efficiently. Additionally, the update includes improved tools for image manipulation and analysis, allowing for more precise diagnoses.
Will this update require any changes to our current workflow?
There will be a brief training period to familiarize staff with the new features. However, the overall workflow should remain similar. The software is designed to be user-friendly and intuitive.
Are there any security concerns associated with this update, Dr. Mihiraa?
We've implemented robust security measures to protect patient data. The update includes enhanced encryption and access controls to ensure the confidentiality of medical images. Now look at question 75. You hear a physiotherapist called Mihiraa talking to a nutritionist. Now read the question. Dr. Peter, I'm concerned about Ryan's recovery from his recent knee injury. He's been struggling to regain his full strength and mobility.
That's understandable. Recovery from a knee injury can be a lengthy process. Have you considered the role of nutrition in his recovery, Mihiraa?
Yes, I believe nutrition plays a crucial role. Adequate protein intake is essential for muscle repair and growth. Are there any specific dietary recommendations you would suggest?
A balanced diet with plenty of lean protein, fruits, vegetables, and whole grains is crucial. It's also important to ensure he's staying hydrated.
I'll advise Ryan to consult with a registered dietitian to develop a personalized meal plan. Are there any supplements that could be beneficial for his recovery?
While supplements can be helpful, Mihiraa, it's important to focus on a balanced diet as the foundation. However, we could consider supplements such as omega-3 fatty acids, which can reduce inflammation and support tissue repair.
Thank you for your advice. I'll work with Ryan to incorporate these recommendations into his recovery plan. Now look at question 76. You hear a chief surgeon called Mihiraa talking to a team. Now read the question. Team, I'm excited to announce that we'll be integrating AI into our surgical procedures. This cutting-edge technology has the potential to revolutionize the way we perform surgeries.
How will AI be used in the operating room, Mihiraa?
AI can assist in various aspects of surgery, from preoperative planning to intraoperative guidance. For example, AI algorithms can analyze medical images to identify potential risks and assist in surgical navigation.
Will AI replace surgeons?
Absolutely not. AI is designed to augment the capabilities of surgeons, not replace them. It will provide valuable insights and support, but human expertise will always be essential.
Mihiraa, are there any concerns about the safety and reliability of AI in surgery?
We've conducted rigorous testing and validation to ensure the safety and effectiveness of the AI technology. However, it's important to maintain human oversight and be prepared to intervene if necessary. Now look at question 77. You hear a nurse called Mihiraa talking to colleagues. Now read the question. Team, I'm excited to announce a new weekly routine shift pattern that will be implemented starting next month. This new schedule aims to improve staff morale, reduce burnout, and enhance patient care.
How will this new pattern work, Mihiraa? Will it involve longer shifts or fewer days off?
The new pattern will involve working fewer days per week but with slightly longer shifts. This will provide staff with more time for rest and personal commitments.
I'm concerned about the impact on patient care. Won't longer shift lead to fatigue and reduced alertness? We've carefully considered this. We'll implement strategies to manage fatigue, such as scheduled breaks and opportunities for rest during shifts. Additionally, we'll ensure adequate staffing to prevent excessive workloads.
Mihiraa, will this new pattern affect our existing shift preferences or seniority?
We'll prioritize the needs of our staff and accommodate their preferences as much as possible. However, there may be some adjustments required to ensure a balanced distribution of shifts. Now look at question 78. You hear a doctor called Mihiraa talking to a patient. Now read the question. Mr. Harry, I've reviewed your X-ray results and there are some concerning findings. We're seeing evidence of a fracture in your left wrist.
Oh no, I didn't think it was that bad. It's just a bit sore, Dr. Mihiraa.
While the pain might not be severe, fractures can be serious. We'll need to confirm the type of fracture and determine the best course of treatment.
What are the treatment options?
Depending on the type of fracture, we might consider casting, splinting, or surgery. We'll need to assess the severity of the fracture and your overall health before making a decision.
Will I need to have surgery, Dr. Mihiraa? I'm worried about the recovery time. Will I need to have surgery, Dr. Mihiraa? I'm worried about the recovery time. Now look at question 79. You hear a nurse called Mihiraa talking to a nursing manager. Now read the question.
Nurse manager, I'm concerned about Mr. Adams' behavior. He's been verbally abusive towards the staff, and it's affecting our morale.
I'm sorry to hear that, Mihiraa. Verbal abuse is unacceptable, and we won't tolerate it.
I've tried to address the issue with Mr. Adam, but he continues to be disrespectful. I'm worried about the safety of the staff and other patients. I believe we should document all incidents of abuse and report them to the appropriate authorities. We also need to have a conversation with Mr. Adam to address his behavior and set clear boundaries.
That's a good plan, Mihiraa. We'll document the incidents and schedule a meeting with Mr. Adam to discuss the consequences of his behavior. If the abuse continues, we may need to involve the patient's family or consider other measures. Now look at question 80. You hear a dentist called Mihiraa talking to a nurse. Now read the question.
Team, I'd like to discuss the importance of effective appointment booking. It's crucial to ensure that patients are scheduled at appropriate intervals and that our appointment slots are utilized efficiently.
That's a great point, Mihiraa. How can we improve our appointment booking process?
One way is to ensure that we're capturing accurate patient information, including their contact details and insurance information. This will help us schedule appointments efficiently and avoid any delays.
We'll make sure to double-check this information for every patient.
Another important factor is to consider the complexity of the appointment. For example, a routine checkup might require less time than a complex procedure. We need to allocate appropriate time slots for each type of appointment.
That's a good reminder, Mihiraa. We should also be mindful of any special requests or accommodations that patients may have.
Exactly. By considering all these factors, we can optimize our appointment scheduling and minimize patient wait times. Now look at question 28. You hear a pharmacist called Mihiraa talking to a patient. Now read the question. Mr. Harry, here's the over-the-counter antimicrobial cream you requested. Remember to apply it as directed and follow the instructions on the label.
Thank you, Mihiraa. I'm hoping this will help clear up the skin irritation.
It should provide some relief, but it's important to monitor the area for any signs of worsening or infection. If the symptoms persist or worsen, please consult a healthcare professional.
Is there anything else I should be aware of?
Avoid applying the cream to broken or irritated skin. It's also important to avoid contact with your eyes or mucous membranes. If you experience any adverse reactions, such as redness, swelling, or itching, discontinue use and consult a doctor.
I'll be sure to follow those precautions. How long should I use this cream, Mihiraa?
The duration of use will depend on the severity of the skin irritation. Follow the instructions on the label or consult a healthcare professional for specific guidance.
Now look at question 82. You hear a doctor called Mihiraa talking to a nurse. Now read the question.
Nurse Harry, I'm concerned about Mr. Adams' condition. His blood pressure is dropping, and he's becoming increasingly lethargic.
Yes, Dr. Mihiraa, I've noticed those changes as well. His oxygen saturation is also low.
We need to act quickly. Let's prepare to intubate him and place him on mechanical ventilation. We'll also need to administer 4 fluids and vasopressors to support his blood pressure.
I'll gather the necessary equipment and notify the respiratory therapist. Should we contact the intensivist?
Yes, please inform the intensivist immediately. We'll need their expertise to manage Mr. Adams' critical condition.
I've contacted the intensivist. They're on their way, Dr. Mihiraa.
In the meantime, continue to monitor Mr. Adams' vital signs closely and be prepared to assist with intubation. Now look at question 83. You hear a nursing manager briefing the duties of each nurse. Now read the question. Team, due to the recent natural calamity, we're facing an influx of patients. It's crucial that we work together efficiently to provide the best possible care. I've assigned specific duties to each of you based on your expertise and availability.
I'm ready to assist in the triage area, Mihiraa.
That's excellent. You'll be responsible for assessing patients' conditions and prioritizing care.
I'll be in the emergency department, assisting with patient admissions and procedures.
Great. We'll need to ensure a smooth flow of patients through the department.
I can help in the observation ward, monitoring patients and assisting with medication administration.
That's crucial. We need to ensure patients receive timely care and medication.
Mihiraa, what about the patients who are currently in the wards?
We'll need to prioritize care based on the severity of their conditions. Some patients may need to be transferred to other facilities if necessary. Now look at question 84. You hear a nurse called Mihiraa talking to a doctor. Now read the question. Dr. Hilton, I'm concerned about Mr. Phillips' surgical wound. It appears to be infected.
Thank you for bringing this to my attention. Let's assess the wound and discuss treatment options.
The wound is showing signs of redness, swelling, and drainage. The patient is also complaining of pain and tenderness.
Those are classic signs of infection, Mihiraa. We'll need to culture the wound to identify the specific bacteria causing the infection.
I've already collected a wound swab and sent it to the lab.
Good. In the meantime, we can start treatment with antibiotics based on the most likely pathogens. We'll adjust the medication once we receive the culture results.
I'll also ensure that the wound is cleaned and dressed properly to promote healing.
That's important, Mihiraa. We'll need to monitor the wound closely for any signs of improvement or worsening.
Now look at question 85. You hear a nursing manager called Mihiraa conducting a morning meeting. Now read the question. Good morning, team. I'm excited to announce that we'll be implementing a new policy requiring all staff to wear compression stockings during their shifts. This initiative aims to reduce the risk of deep vein thrombosis, DVT, and improve overall well-being.
That's a great idea, Mihiraa. I've heard compression stockings can help prevent blood clots.
Exactly. By applying pressure to the legs, compression stockings can help improve blood circulation and prevent blood from pooling, which can lead to DVT.
I'm concerned about the comfort of compression stockings. Won't they be uncomfortable to wear for long periods?
While they may take some getting used to, modern compression stockings are designed to be more comfortable and breathable. It's important to choose the right size and compression level for optimal comfort and effectiveness.
Mihiraa, will we be provided with compression stockings or should we purchase our own?
The hospital will provide compression stockings to all staff members. We'll ensure that everyone has access to the appropriate size and compression level. Now look at question 86. You hear a doctor called Mihiraa talking to a nurse. Now read the question. Nurse Hilton, I'm concerned about Mr. Phillips' long-term prognosis. His condition has deteriorated significantly.
Yes, I've noticed a decline in his overall health. He seems to be struggling more with daily activities, Dr. Mihiraa.
We'll need to discuss end-of-life care options with Mr. Phillip and his family. It's important to involve them in the decision-making process.
That's a difficult conversation to have. Should I initiate the discussion or would you like to speak with them directly?
I think it would be best for me to have a direct conversation with Mr. Phillip and his family. I can explain the current situation and discuss the available options.
That's right, Dr. Mihiraa. I'll schedule a meeting with Mr. Phillip and his family to address their questions and concerns.
Thank you. We'll need to provide them with information about palliative care, hospice services, and other end-of-life options. It's important to support them during this challenging time. Now look at question 87. You hear a physiotherapist called Mihiraa talking to an occupational therapist. Now read the question. Dr. Hilton, I'm concerned about Mr. Phillips' mobility limitations. He's struggling with activities of daily living, and I believe he could benefit from assistive devices.
That's a good point, Mihiraa. What specific devices do you think would be helpful for him?
Based on his current condition, a walker or a cane might be beneficial for ambulation. Additionally, a grab bar in the bathroom could help him with transfers and maintaining balance.
Those are excellent suggestions. We should also consider his home environment. Are there any modifications we can make to his home to improve his mobility and safety?
Perhaps installing ramps or widening doorways could be helpful. We can conduct a home assessment to identify any necessary modifications.
That's a great idea. We can also discuss the possibility of obtaining a wheelchair or other mobility aids if needed, Mihiraa.
It's important to select the right assistive devices to meet Mr. Phillips' specific needs and ensure his comfort and independence. Now look at question 88. You hear a head nurse called Mihiraa conducting a meeting. Now read the question. Team, I want to discuss our emergency evacuation plan. It's crucial that everyone is familiar with the procedures in case of a fire, natural disaster, or other emergency.
I remember going through the evacuation drills last year, Mihiraa.
That's great. It's important to review these procedures regularly to ensure everyone is prepared. In case of an emergency, we'll follow a designated evacuation route and assemble at the designated assembly point.
What should we do if we encounter someone who needs assistance during the evacuation?
If you encounter a patient or colleague who requires assistance, please inform the evacuation team leader immediately. They will coordinate the necessary support.
Are there any specific items we should grab before evacuating the department, Mihiraa?
It's important to prioritize patient safety and evacuate promptly. However, if time permits, you can grab essential items such as your personal belongings and any necessary medical equipment.
Now look at question 89. You hear a doctor called Mihiraa giving a handover to a colleague. Now read the question.
Dr. Hilton, I'm handing over Mr. Philip to you. He was admitted earlier today with chest pain and shortness of breath. His vital signs are stable, but we're still monitoring his cardiac status.
Thank you, Dr. Mihiraa. I've reviewed Mr. Philip's chart and am familiar with his history.
He has a history of hypertension and high cholesterol. We've administered pain medication and oxygen therapy. Please continue to monitor his vital signs and report any changes.
Will we need to conduct any further tests?
Yes, we'll need to order an electrocardiogram, ECG, and cardiac markers to assess his heart function. We're also considering a chest X-ray to rule out any underlying pulmonary conditions.
I'll coordinate the necessary tests and inform Mr. Philip about the plan, Dr. Mihiraa.
Please ensure he's comfortable and has any necessary medications readily available. We'll continue to monitor his condition closely and adjust treatment as needed. Now look at question 90. You hear a nursing manager talking to a junior nurse called Mihiraa. Now read the question.
Mihiraa, I need you to double-check the infusion pumps on the night shift. We've been having issues with the new model, the AccuFlow 3000. Several patients have experienced medication errors due to inaccurate flow rates.
Okay, Linda. I'll be extra vigilant. Anything specific to look for?
Yes, the primary concern is the calibration. If the pump is off by even 1/10 of a milliliter per hour, it can lead to serious complications. Also, watch for the alarm system. We've had instances where it's malfunctioned, causing delays in patient care. And, there's been a software glitch affecting the bolus function. Make sure you're familiar with the workaround.
Got it. I'll review the procedure manual again. I'll also cross-check the flow rates with the 4 bags to be sure.
Good. And remember, Mihiraa, if you encounter any problems, don't hesitate to call the biomedical team. Patient safety is our top priority. That is the end of your OET listening test. Now check the answers.